Hello, my name is Cassandra Exum, and I'm doing my case study on malaria. Malaria is a mosquito-borne illness that is caused by a parasite. Symptoms include fever, chills, and flu-like symptoms. Because these symptoms are so common, they can often go untreated, which can result in severe complications and death. In 2016, there were an estimated 216 million cases of malaria worldwide, and 445,000 of these cases resulted in death. Approximately 1,700 cases of malaria are diagnosed in the U.S. each year, mainly travelers and immigrants returning from sub-Saharan Africa and South Asia, but malaria can be found in the United States. Malaria depends on temperature, humidity, and rainfall. These mosquitoes like tropical and subtropical areas. However, transmission will not occur in very high altitudes during cold seasons or in deserts in these areas that the mosquitoes would typically like. The highest transmission is found in Africa south of the Sahara and in parts of Oceania such as Papua New Guinea. The map I included shows where malaria occurs throughout, occurs in some parts, and where it is not known to occur. I did some looking to see how socioeconomic class relates to malaria, and children are the most susceptible. They have compromised immune systems. In the Gambia Malaria Indicator Survey, found that children living in houses with poor walls, floors, roofs, and windows were significantly associated with higher prevalence of malaria. The odds of malaria infection doubled on average in the poorest children within a community compared with the least poor. So these mosquitoes are able to get through compromised walls, floors, roofs, and windows, and children are more susceptible to contracting the illness. The medication that was used for decades before, chloroquine, cost only about 10 US cents per course of treatments for an adult. However, due to antibiotic resistance, we have now had to switch to what is commonly known as ACT. It is a combination drug, which does make it more expensive. It now costs US $2.40 per course. However, this is just the wholesale price, and it can be marked up to 5 times that amount in pharmacies in Africa. This is a problem. So malaria has been eliminated from many developed countries with temperate climates. This was part of a campaign that started in the 50s to eradicate malaria, but it failed globally due to problems including the resistance of mosquitoes to insecticides, the resistance of malaria parasites to drugs used to treat them, and just administrative issues. We now have something called the President's Malaria Initiative, and this is a $3 billion initiative that is hoping to rapidly increase malaria control interventions in 19 African countries and 6 countries in Asia. We also have rollback malaria, which all these organizations work on programs together to fight malaria. Possible future outcomes: we could see a vaccine. Preferably, this vaccine will not require boosters. We could see better nets that help prevent malaria. Right now, the nets typically have to be retreated with insecticide every 6 months. So ideally, long-lasting nets that do not require this retreatment. Better methods for diagnosis. It needs to be affordable. The methods that they're developing right now are actually more expensive than we have currently, but that would be okay if they lasted longer, and we could save offset costs for maybe the overdiagnosis of malaria or having to constantly ship and replace faulty methods for diagnosis. We also need better financing of drugs. Obviously, the drug price is increasing due to antibiotic resistance. So in order to treat these poor communities, preferably a drug that would be more affordable. And this is my bibliography. I hope you enjoyed learning about malaria.